everybody. It's Nina, Sika's Professional Affiliations and Education Manager, and I'm excited to bring you Dr. Katherine Saunders today. So she is a co-founder of Intellihealth and practices at Flyte Health or Flyte Medical. And she and I got to know each other pretty well this past year when we were on a panel for a nutrition meeting talking about access to care and obesity. And I wanted to bring her on to talk to you all about obesity medicine and her practice and some of the things that we've been hearing in the media and kind of give you the real information about that. So thanks for joining me.
Thanks for having me, Nina. I'm so excited to be collaborating with you again.
Yeah, so I did actually get to listen to a podcast you were on recently this morning. And so I'm actually going to link to that because I think you did a really good job talking about some of the questions that we get a lot about obesity medicines, this newer class, right? And I like how you kind of bust some of the myths about that and talk about access to care and some of the things we're hearing in the media about shortages and side effects and off-label prescribing and I want to refer to that so that we don't have to go down that path. But what I'm actually most interested in talking to you about is kind of got interested as you did an article or contributed to an article that was talking about Ozempic-face, right? So I know in healthcare, a lot of times we sort of roll our eyes and are like, oh, I can't believe the media is getting this so wrong. But I do think we have a chance to really communicate with the media right now. And I think you're someone who's doing a really great job representing the science and the evidence and really reframing those conversations back to what matters. So let's, if you want to talk to me a little bit about what is that, and maybe that's the colloquial term for it, and that's not what we would call it, but what should we be referring to? Because I think it does come back to a important medical component of, weight loss, significant weight loss, changes in body composition, and what we do to kind of combat that.
Great question, Nina. There's been so much focus on some of the more superficial aspects of everything. But the more important focus is that there are changes that happen to people's bodies besides just, numbers on the scale changing as people lose weight. And now, especially with the medications we have that are associated with, pretty significant weight loss in many people, we have to really think about what's happening to people's bodies in addition to just focusing on numbers on the scale. And so we talk to our patients so much about body composition changes. And how, unfortunately, right now, with the way people lose weight on the medications that we have, people lose both fat mass and lean body mass or muscle mass. And what we want to focus on is preserving as much muscle mass as people lose weight. So the importance of exercise and specifically strength training or weight resistance as people lose weight to preserve as much as possible.
So people are losing weight. Do you have parameters that you talk to patients about of say they're losing 100 pounds, what would be, acceptable, or do you give them any kind of essence of what would be acceptable for lean mass loss during that time?
So unfortunately, we don't as much as we should be right now, just because it is, expensive and difficult for patients to have access to, a way of checking their body composition. Mm-hmm. There are, more, inaccurate ways of doing it. And for some people that may be enough. It's maybe less about the absolute number and more about the comparison. So seeing where someone's starting from and then, looking at the changes as they lose weight. I wish we had an inexpensive, cheap way of testing accurately for our patients, and then we would be able to give them more feedback. But for right now, we just talk about maximizing strength training and resistance as much as possible, and unfortunately don't get into the numbers as much unless people have a way of measuring.
Okay. Yeah. And I know, like in my background with bariatric surgery, this is the ultimate, right, where people are losing a significant amount of weight in the first 6 to 12 months. And really, just looking at them and looking at their weight is not enough to tell, oh, is this person losing too much muscle? And I think it really became clear, for me as a dietitian with those patients, after they've lost too much, like it has a lot of negative health effects. They can't, they can't build it back as easily as it's lost. It changes their resting metabolic rate, and I've seen some newer studies linking it to some of the weight regain. If you've lost too much and you've driven your metabolic rate down so much that when you're out of that active weight loss phase, what happens then? And are those people more prone to regaining weight?
Yeah,
I've
that
seen.
brings up
I was just going to say, I
sorry.
see 20 and 30% talked about a lot. As far as if you're losing much more than that, then that can kind of be a trouble spot. Obviously hard to determine what that is without assessing it. But luckily, I do feel like the conversation is shifting to where we're finally at that point of everyone saying, okay, weight and BMI are not enough. We're really starting to see conversations shift to, okay, well then what? What do we use? Do we use waist circumference? Do we use that as a proxy for visceral adipose tissue? Do we, use some of the measures of body composition, bioimpedance, DEXA, what's available? What do people have? And even some of the home scales that people are using, I think it's important to have metrics, and we are, I think, working towards this becoming more standard practice. So I do hope to see that in our next couple of years, where people are just doing that routinely.
Yes. And as we've talked about before, Nina, until body composition measurement is really kind of in guidelines and standard of care, it's going to be hard to, have that be the expectation. But brings up a really important point too about, weight loss is really such a different phase than weight maintenance. And there are so many different strategies that we use in each phase that are, important to each phase. And so most people think that, losing weight is the hard part, but once people lose weight, we talk to our patients about not taking that for granted. They worked so hard to lose the weight, and things can change anytime. So we do a lot of education about, bumps in the road, expecting them, you're going to have bumps in the road. And some of the most powerful tools for success with weight maintenance, one is weighing. And I would argue, as we talked about, checking body composition as part of weighing is a big thing. Having close follow-up with your care team, so you have the right amount of support. My patients know that if they start gaining 2, 3, 4, 5 pounds, we want to know, and we want them to reach out for help before it turns into 50 pounds. Continuing to take their medications. So not stopping a medication and expecting the weight to just stay off. And, continuing with the same kind of, dietary approach, and continuing with exercise, and really, once people have lost a lot of weight, doing as much exercise as possible to kind of counteract as much as possible the reduction in, basal metabolic rate, and everything that we can do to, just make it easier for people.
I think that's great. And, I know one of the parts of your practice that I really appreciate, and I'm seeing, from other colleagues, is getting involved with an interdisciplinary team, with dietitians, with exercise physiologists, with behavioral health, getting people on the team to help with some of those components, right? So, it shouldn't be a one person team. We don't want to burn out our healthcare providers. And I think it's going to be one of these, realizations, just like in bariatric surgery, right? Like there was always this understanding that it's not just the surgery alone that keeps weight off long term. And so I think as we see people get out of the initial phases of that rapid weight loss, that curve that you see where they're losing weight pretty quickly, I really do, think it's important to think about all the tools, whether that be assessment measures and tracking and trending and measurements, or those tools are people who are helping them. So, I think including, like you all do, dietitians on the team, and maybe you can tell me a little bit more about what you all are doing to sort of support folks long term in that maintenance phase.
Yeah. So exactly. It's so important to have a multidisciplinary team. This is really specialized care that requires, a robust care team, to provide patients with as much support as possible. A lot of patients will say, oh, I don't need to see a dietitian. I know what to do. I'm just not doing it. And I always explain, it's not just about the education, it's really about, behaviorally, why aren't you doing what you're trying to do? And dietitians can help with that. And, I recommend that people have an agenda and come in with their questions and keep a food log for a few days before seeing a dietitian so that they get so much more out of it. And then I think our patients have more buy-in and more of an understanding of why that's important. Because what happens with weight maintenance is that you can't even predict it, but sometimes someone goes on a vacation or they have a big event, or for some reason something changes about the way they're eating. And let's say they start eating a lot more carbs and sugar, that can start this kind of vicious cycle of developing increased hunger and increased cravings because of the change in their diet. And then they don't even realize what happened and when it started, but they're suddenly much more hungry and they have more cravings, and then they start gaining weight, and then it's a vicious cycle with the weight gain. And when we see them and try to figure out when did this happen, when did this start, what was going on around the time this started, and remind them of what they were eating before, what their lifestyle was like before things got thrown out of whack. It's so important to, have these touch points with physicians, with dietitians, with other members of our team, so that we can catch people when they start getting off course and really identify the factors that led to them getting off course and address them, as they come up before things get really out of control.
Absolutely. Yeah. Well, let's hope that everybody's on that same kind of philosophy and able to get their patients to that. I think that patient-centered care approach and individualizing, with your team is really important. So that's great. I do have concerns about some of the practices that are just doing some of the maybe more fringe practices that are just doing medication alone and not really engaging all the components of a comprehensive team. And I think, we're seeing more of that too. Like, you have an effective treatment. And so people are getting excited about that and wanting to offer that. And that brings out some entrepreneurs too, and some tricky stuff. So I appreciate your voice in navigating all of this and really trying to educate the public about, what are we really doing here from an evidence-based science perspective. And yeah, as it comes to Ozempic or Wegovy or any of the newer meds, I think we'll keep hearing more about some of these newer advances and keep focus on how we can best prepare our patients to keep the weight off, to keep their body composition in a favorable way so that they are experiencing optimal benefits. And, I think the Ozempic-face to me was a way that people are focusing on the I don't know, the shallower aspects of that and saying like, oh, this is a reason not to do it. But what we know from working with patients with obesity is it's about health and not just their weight, right?
Yes, I think it always needs to come back to the evidence and the focus on medicine and science and health. It's so important to, have the right goals, and to, talk about this in an appropriate way, and really, do it in a comprehensive, multidisciplinary way. Is what leads to, sustained weight loss. So just giving somebody a medication and not having any other infrastructure can really backfire. And let's say patients are on medications that are leading to weight gain, or they have other, weight-related comorbidities that haven't been picked up. That can be a problem. And then, you can be on an effective medication and be losing weight, but there's still other things that are going on that should be part of a comprehensive care plan. And then, with some of the newer medications, it really takes education and, support to have these work well and work as they're supposed to be, work and, be tolerable. If people don't change the way they're eating or how they're eating, when they're eating, what they're eating, and just take these medications, of course, there are going to be a lot of side effects. And so working closely with a dietitian to understand how to make these changes, and then checking in periodically, to see if there's side effects and, how we can stop things early and what we can change to make these medications effective, because they need to be tolerable and they need to, fit into a person's lifestyle, because this has to be long-term. So much more is needed. And thank you for, focusing on that. I think that has been lost a little bit with all of the new publicity. So thank you for your focus on this, Nina, and love joining forces with you to talk about body composition and all the aspects of obesity care that we both are so passionate about.
Yes. Well, thank you so much for joining me, and I'll continue to follow and share your work, and appreciate all you're doing in the field as well.
Thanks, Nina.
Thank you.